Welcome to First to Follower podcast, presented by Youth for Christ USA. First to Follower aims to address the unique challenges and opportunities youth ministry leaders face today. Through engaging discussions and expert insights, we aim to provide practical guidance, relevant resources, and support for the spiritual formation of youth leaders as they navigate the complexities of reaching and discipling the next generation. I'm your host, Cory Huffman, and I work on the Youth for Christ USA Leader Formation Team. And on this episode, I'm welcoming on Ryan Anderson from YFCUSA's Ministry Advancement Team and mental health coach and executive director for We Are Speak Out, Lauren Wilson. Ryan Anderson is a senior national ministry specialist for Youth for Christ USA. Ryan has served in Youth for Christ for 15 years, first as a campus life director in Peoria, Illinois, then as a campus life regional coordinator, and as the national campus life director. His heart is to come alongside field staff to resource, encourage, and support them in the work they are doing. Lauren Wilson founded We Are Speak Out in 2018 after completing her psychology degree and spending her early career working at a residential treatment facility, supporting people on their journeys to recovery. Lauren leads We Are Speak Out, advocating for mental health awareness in the local church and providing resources for both organizations and individuals. On this episode, we're discussing the topic of suicide prevention. All right, I'm here with Ryan Anderson, Senior National Ministry Specialist overseeing campus life. How's it going, Ryan?
It's going great. Hi, Cory.
Hi. And mental health coach and the executive director of We Are Speak Out, Lauren Wilson. How are you doing, Lauren?
I'm doing well. Stoked to be here.
Yeah, it's great to have you. We're excited to have this conversation. And so maybe before we jump into our main topic, We Are Speak Out, can you tell us a little bit about what is We Are Speak Out, what it's all about, and what do you guys offer?
Yeah, we are a mental health nonprofit. We started about 8 years ago, and we started because we just saw this big need in the local church and parachurch organizations when it comes to training and equipping leaders on best mental health practice. So our board of directors is psychologists, therapists, and pastors, and we just come together and say, hey, how can we help to love the church back towards some health when it comes to navigating these mental health conversations. So we actually work with Youth for Christ in Eugene quite often, which has been really fun. But we also work with a variety of youth groups and churches and things like that. So we do a lot of training. It's for parents, youth leaders, mentors, but then we also work with church staff. And Cory and I just sat and did a church training with them. So it's been fun. Yeah.
Yeah, and that was awesome. I sat through that training, and that was one of those things where we had just gone through some stuff, or just had a scenario where we needed some of that training, and so that was really helpful. And then coming out of that, felt like, man, this is stuff like a really good 101 base level stuff that all of our listeners and youth leaders need to have at their disposal. So glad to have you on, and so we've. We're in a time where I think, and Ryan, you could echo this, where mental health and talking about mental health has definitely increased a lot. And I think a lot of our leaders are able to put some words to some of the things they're seeing. We're talking about trauma-informed care and lots of different spaces. One of the things that at least I feel like I've seen within Youth for Christ and some other spaces, and even my own kind of ministry experiences, is when it comes to things like a topic of suicide or suicidal ideation or those kinds of things. I hadn't had a lot of experience in that. Didn't have a lot of training or information about that. So that was a space where I was a little bit in the dark and kind of scared to even lean in. Like, what if I say the wrong thing? What's that look like? What am I supposed to do? And to have you come in and start to share about that really helped me to kind of step back and go, okay, this is something we can approach and figure out. And it's also really helpful and needed. So maybe as we get ready to dive in, I know that it's a part of your story. Would you be up for maybe sharing a little bit of your story and your journey in that space?
Yeah, absolutely. I grew up in the church. So first of all, just was basically born and raised within the church building. My parents were deacons, and so I was very familiar with mentors and was part of Awana and all sorts of youth groups. But starting in about, I think it was about 8th grade, really was struggling with my own mental health and just didn't really know where to go, who to ask. My parents were dealing with some of their own stuff. And so had a couple of mentors that just came alongside me. And part of that struggle was really starting to struggle with some suicidal ideation, which if you're not sure what that really means, it's like the idea of suicide. So like, I don't want to wake up in the morning, or what would life be like if I wasn't here anymore? And there's a difference definitely between ideation and suicide with plans and attempts. We'll talk about that later, but had a lot of ideation, and had some really great mentors come alongside me. That actually was a journey that lasted from about 8th grade all the way through college and even adulthood. And over the years, I've just been like, man, I am just someone that's a little prone towards suicide. My brain just goes there when I'm not doing well. And through Speak Out and, education and my own story, we've kind of created this working theology of like, how do I process and navigate as a Jesus follower, someone that also is struggling with suicidal ideation. I've had a few attempts, have had some really great community along the way. And I think have just landed in this space of like, this might just be something that I struggle with my entire life. When there's seasons that get really heavy, when there's spaces that I feel like I've like seen and experienced too much, it's time for me to add in a little extra care, slow down, take things off my plate, kind of reassess like what I'm going through, what I actually need to take care of versus what someone else can take off my plate. And I think we've realized like it's similar to like an emotional cancer of the brain. We kind of use that example because I think it helps us to destigmatize suicide quite a bit too, of like, you'd never shame someone for struggling with cancer. Like, you're never going to be like, what did you do? Why'd you go and get that diagnosis? Right. And I think it helps us to also then define what type of care needs to happen. I certainly have known people that have struggled with, their family members have struggled with cancer, and like, it's all hands on deck. You have doctors, you have specialists, you have nutritionists, you have community coming around. You typically have, family and friends coming to help take care of kids or animals or the house or, whatever it might be. And I think the same is actually true when it comes to suicide. Of if it is the emotional cancer of the brain, we need care teams and people to come alongside of us. And so over the years, I've created that for myself too. Even now have a care team that when I'm not doing so well, we'll call up and be like, hey, like, all hands on deck, time to come and like, figure this out together. And so a lot of what we do with Speak Out and suicide prevention kind of has come from part of that story of like, how do we create safety teams and care teams? It's worked for myself. It's worked for, dozens of other people through Speak Out. But yeah, it's been certainly a journey. As I'm running a mental health nonprofit too, I'm sure you can imagine, like, there's seasons where I'm like, man, I really also need to take a deep breath and take a break and take a minute to focus on my own mental health. But yeah, it's something that we've helped to destigmatize. It's a lot easier to talk about because it's become kind of a normal part and rhythm of my own mental health care. But I wish we talked about it more openly like that, rather than being fearful of talking about it. And we were able to destigmatize a little bit of it. So part of what Speak Out does is some of that, of how do we normalize these conversations? How do we enter into conversation without being really fearful, which it is scary. It's a scary conversation. But I think there's things we can do to help navigate it, help it feel a little bit less fearful and more full of hope. And like, we're there to just help care for someone that's really struggling.
Yeah, no, I love that. Thank you for sharing that and being willing to share your story. Just even just that, is a huge thing for, I think, destigmatizing it a bit, to just, to hear that struggle in the journey. And it just shows how important the work you're doing is for you as much as for everybody else. Yeah. So speaking of that, so Ryan, as you are connecting with ministry leaders across the country, and you yourself have been in direct ministry too, and are still connected with kids and stuff, like, what's it been like for you in terms of seeing, like, the stigma or whatnot, do you see people talking about suicide prevention? Is it something that that you've dealt with or ran into in some of the spaces you've been, either as a leader or working with leaders?
Yeah. I mean, obviously, I feel like there's a massive increase over the last several years in terms of mental health awareness and suicide prevention and all these different things. And I think a lot of what I'm hearing from the field, especially, is, I mean, Lauren, you talked about the fear of talking about it. And I think that fear is on two sides. One is a student who is, dealing with it. They're afraid to share it, but there's also fear on a leader's part of like, if somebody shares this with me, I have no idea what to do. And so both of those sides of fear exist. How do we create a safe space for a student to be willing to share what they're going through? And as a leader who is I think you said, a part of that community of care, how do we prepare ourselves to be a safe space and to even know what to say or do if we're approached with something like that?
And Lauren, I know we're going to dive into answering some of those things and whatnot. I imagine in all the work you're doing, you've seen a lot of stats and probably seen some research. I would love for you to share, just what you have in terms of some of the stats, just so we can be aware of those things too. And then it'd be it'd be good to dive into more of this conversation, more of these answers.
Yeah. I mean, we certainly have seen an uptick in young people talking about mental health a lot more, especially since COVID. I know we have probably an audience all across the United States, but Oregon, we have like the most number of individuals struggling with mental health and the least number of resources. So Oregon, Pacific Northwest is in a pretty rough spot when it comes to the resources we have. Young people, which when I say that, it's like 12 to 24 is kind of what we're talking about. I think it's about 1 in 5 have a clinical mental health diagnosis. 1 in 5 typically struggle with anxiety. It's about 1 in 4 that struggle with depression. And then even in the last 2 years, and this is really shocking to me, but there's 1 in 10 young people that have like seriously thought about suicide in the last couple of years.
Wow.
Which to me is like just so staggering. Obviously that's not, they've attempted. I think that would be an even larger crisis, obviously. But even the fact that we have young kids that are just thinking about it, I think should be a huge wake-up call to us as the Big C Church, as safe adults, as people that work with young people, that whether or not you've heard about it, it likely is present in your youth group or in your ministry. And it's I believe in 2025, it was the second leading cause of death among young people. And so suicide is certainly something we have to talk about. And our psychologist on our board works at an elementary school. We were just talking about how early does it start? And we were finding some statistics that said suicide, the average age of someone that struggles with suicidal ideation. So we talked about, that idea of suicide is 10. So this is not hitting our teens later on. I think there's this kind of thought with a lot of adults that it doesn't hit kids until they're in high school or young adult life. But I actually think it's hitting our students much earlier on. Part of that, I think, is Gen Z and Gen Alpha has done a great job of destigmatizing it. And so I think everyone's kind of talking about it now. It's not uncommon for young kids to talk about seeing their school counselor or their therapist, or my parents have a therapist. And that certainly was not the case for me growing up. And so I think part of the numbers that we're seeing is just where young kids are able to talk about it a little bit more. And then it's our job as adults, and we can talk a lot more about this, but it's our job as adults to take a young kid's crisis as crisis. It's not our job and responsibility to define whether or not that's a crisis for them or not. We all have different capacities. We all have different things we're holding. And so as a 10-year-old, their suicidal ideation may look a lot different than a 17-year-old. Still that ideation, still the thoughts of suicide, still something that is a warning sign for us to then take appropriate measures and come alongside them. But yeah, I think they just maybe have some language now as younger kids for the overwhelm that they're feeling. And whether or not they'll act on it or not is still, I think, is a huge warning sign for us to say, like, okay, we need to start taking just mental health in general really seriously. So these kids have better tools rather than just feeling like they're diagnosing themselves and that's their identity and that's it. You know, they struggle with anxiety. That's just me. That's not, I mean, we know that's not what we want for them. We have a lot of tools that we can teach young kids, but I think that the gap we're really seeing right now is the stigma is no longer there, but we haven't taught them the tools that they really need in order to then not just be riddled with anxiety or overcome by depression or just like so hopeless that suicide feels like the only option for them.
Yeah.
I was going to ask, how do people like me, a leader walking alongside a kid, how do I understand what the difference is between, I don't know. I think adults a lot of times say, oh, that's just a phase, or they minimize things, or they misread behavior as something that it isn't. They downplay it, whatever it is. How do we navigate that difficult journey of like, this is something to really take seriously versus they're having a bad day?
Yeah, that's a great question. So with a clinical diagnosis, so if someone was to actually have a diagnosis of anxiety or depression, it actually has to be something that is ongoing and persistent for longer than 3 months. So teens obviously have all sorts of emotions and bad days and say things flippantly. And because we talk about mental health a lot more, kids are going to throw certain things around of like, I just wish I wasn't here anymore. Which those we need to take seriously, have a follow-up conversation. But I think it's our role as mentors, as adults in these kids' lives to kind of help them keep track of like, hey, this seems like it's been going on for a few months now. Bad days are one thing. I have bad days all the time. My anxiety sometimes is like just so overwhelming. And does that mean I have an anxiety disorder now? No. But if that was ongoing and persistent for 3 months and it was really affecting the way that I was able to show up in relationship or do my, daily duties or perform at work or for them at school, that's when we need to start thinking about like, maybe we need to get, some additional care here. Those anxious feelings, we still can teach them tools to help overcome, or those depression seasons, like, hey, let's make sure that we're eating really well, we're drinking a lot of water, we're able to get outside and exercise. Figure out what kind of lies you're believing. How do we replace those with some truth? Like, I see you have value. I know your brain's not telling you that right now, but let's do some things to help in those rough days. But I do think it's it's important to take things a lot more seriously once it's like, oh, this is becoming a pattern. Like so-and-so is really changing the way that they're showing up or not showing up anymore. And I think that's our cue to really check in. And often it's sooner than later. Like kids are not going to be offended if, week 3 or 4 that you're seeing these things, you're like, hey, like, can we maybe let's figure out how we can help you out. Like, I know this would be exhausting to, navigate this type of thing on like for, 3 or 4 weeks. How do we help find some other people to come in and help support you? I'm not going anywhere, but I know maybe seeing the school counselor would help, or could we chat with your parents? Or if they don't have, safe parents, who else can we pull in? Another youth group leader, another pastor? Does your church have resources? But the goal is like that when students are really struggling and you can see that it's starting to affect them, we start to bring in like 3 or 4 other adults to help support them. So we don't have just you and them. This is like a non-negotiable when someone's struggling with suicide, but with anxiety and depression, it's often helpful too, of like, who's kind of your team? Who's your safety team? Who's the people that are going to come around you? So when you are having rough days, we all can kind of be on the same page, and it's not just you as a leader. I think I see that a lot in youth groups is, well, they shared that with me, and so now I don't really know what to do, or I don't know if I can invite others in. And Like, this is what you mentioned, Cory, like some trauma-informed stuff that you guys have been doing. Like, this is where collaboration really steps in with that trauma-informed care. Hey, who else could we invite into that conversation? Give them an option. You're not just sharing their story and like pulling others in without their permission, but, to remind them that like, hey, you have a lot of value here. We want to make sure we care for you well. And I want to make sure that if I'm not available for some reason, you have someone else you can chat with about this too. So who else could we maybe invite into this?
Yeah, no, it's good. And I think on that same note, I think I asked you this question when we were in person, because I had, just before you came in, we had a student in our group who shared with the leader, just like, hey, been having, a few suicidal thoughts, but it's no big deal, no big deal. I shared with my dad, I was kind of like, just kind of played it off and, but had shared it with a couple leaders, and we heard about it. And we've had other instances of like abuse or assault where you have to report, you're a mandatory reporter. So I think that was our first big question is, okay, when someone reports that they are having suicidal thoughts or ideation, is that the same as one of these other spaces where we got to report it and you go to CPS or, and so that was the first question. And also, I think like you're talking about where someone might be hesitant to bring in other people is because those are like, it's sort of different, like I know if when I report this is going to start a chain of events that, and you have to do it, but it's a whole different thing. Getting to hear from you on that was helpful about the differentiation of that too. So maybe you can talk a little bit about that as well.
Yeah. So if someone is sharing with you like, hey, I'm suicidal, I'm thinking about it, there's a few follow-up questions we have to ask. And our goal is that these are not in front of other students and that there's maybe one other person, adult, with you, because this is where that fear really kicks in. You're starting to feel some fight or flight, and you're maybe not going to remember everything. That's okay. We just have to work with that. We have to bring in some other people to help remember some of those details. So there's a few follow-up questions that we have to ask. One, like, have you thought about a way you might act on that suicide? That's always the first one, because if someone's like, oh, no, I just don't want to be here anymore, that's a different conversation than, well, yeah. And then a follow-up to that would be like, okay, do you mind like telling me how you might act on it? And this is where we really need to have at least another person there with us. And there's going to be some additional follow-up stuff for sure. If they are willing to tell you, it's then your responsibility to, with this other person, to figure out like if they have a time and a place that they might start acting on it. If it's immediate, this is when we're calling 988, which is a suicide hotline. It's nationally run. We actually just revamped it as a nation, which has been really great. And so you're not on hold anymore for both the individual that's supporting and the person that's really struggling. So if you're mentor, work with kids, you should just call it in general just to see what that conversation is going to look like. You're not taking someone away from someone else. They're just there to help figure out what are the next resources, and really be like an additional layer for you. So yeah, I have a plan. This is when I'm going to act on it. And, this weekend or whatever. So if that's the case, then we're going to take that individual to the emergency room, whether it's through an ambulance or with some other people. We never want them alone in the back seat by themselves. Yeah. We want to make sure someone else is sitting with them back there. And ideally, we're also asking, like, can you be safe to get there? Are you going to, put us or yourself in danger? And this is where kind of your best judgment comes in. Hopefully, you know the kid pretty well. If you are uneasy, you can always call law enforcement and they'll come and help with that. That is not on you. That is not your role to get them to the emergency room, but we do need to try our very best to get them there. And the beauty of 988 is if you're able to be on the phone with them or someone else is able to kind of relay information, they can actually dispatch someone. And so if you hear like, I don't know if I can stay in the car, 988 is going to be able to get some people to you as quickly as possible. So this is why it's really helpful to have like two people there, someone that can kind of go and call if you need to. And yeah, so there's some follow-up things. Do we need to call CPS in suicide situations? If there's abuse as well, it's helpful. Like additional information for them to know, but typically it's our job to get them a suicide risk assessment to get them to the hospital, and they're going to be able to help navigate, kind of next steps. And then they're going to fill out all the paperwork that you would need that says, hey, so-and-so has attempted, or they came to the emergency room again. So some documentation is helpful. And especially if there's kind of some ongoing things, it's helpful to call. If you've never called CPS before, just to give people a little less fear around it, the first time you call, they're not going to go banging down someone's door. They're opening up a case number, they're gathering information, unless someone's life is like truly in danger in that moment. Then they'll send some people out. But if there's something that happened in the past or something that they're kind of being, secretive about and telling you, their CPS is basically going to create a case. So like, hey, here's something that's happened. Next time you call, hey, someone else called, and they're going to figure out the best way to handle that situation. So just because you call once does not mean you are like ripping it apart an entire, home life, which I think is helpful to hear of like,
definitely.
I'm not just causing chaos for this kid.
Right.
Yeah, I think a lot of leaders, we've got like movies in our mind where someone makes one call and it's like, and it goes crazy. But no, it's there's a process.
There's a process.
Yeah.
Yes.
And then 988 is even more of it's a little more just supportive of you, right, as you're calling, or the person who's on the phone. So it's even a little different that way.
Yeah. So 988, if you're unfamiliar, it's our national suicide hotline. And so if you are struggling with suicide yourself, honestly, if you just need to talk to someone, you don't have anyone to talk to, and you're just having a rough day, you can call 988. I've had some friends that are like, no one was free, or I just didn't want to feel like a burden. And so I ended up just calling, and I needed someone to listen. And so you can kind of use it as that. You'll never get the same person twice. And so this isn't a replacement to therapy, but if you do need someone to just keep you company, or chat with you for a bit, that's what they're there for. And then the second is if you're working with someone and you're like, I don't know what to do. I don't know even what's open right now. It's 3 a.m. Like, how crazy is the emergency room? 988, you can call and say, essentially just explain the situation. Hey, I just got this text from this kid. I don't know what to do. I think they're home. They're not answering anymore. And they're going to be kind of that safety net for you as a leader to walk you through those next steps, because your fight or flight's definitely going. That's okay. That's a good thing, right? Someone's in danger. But in that space, it's helpful to have someone as kind of a safety net. I've also called after I've handled a situation and I'm like, man, I feel like I forgot something. Like, I feel like there was one more thing that I missed and I like can't figure out what it is. I'll just call and be like, hey, this is what just happened. This is what I did. What am I missing? And they'll just be that kind of grounded, regulated presence that's trained, that's like, oh, actually, that was great. Or like, ooh, yeah, we did miss something here. So 988 is a great resource. I told Cory and his team all of this in the leaders training or staff training. But if you have never called 988, I'd really encourage you to call now when you're not in crisis. It can be a really scary thing to be like, I don't know. I don't know what's going to happen. And so if you work with students, just call and say, hey, my name's Lauren. I work with kids weekly. And I know that our suicide rates are like increasing. I've never called this before, and I just want to be prepared. So if and when I need to call, I know what to expect. And they're gonna be like, that's great. And you'll say, where are you? Like, I'm located in Oregon. What does Portland have? And they'll be able to like walk you through some resources, or what can I expect? Are you going to force kids to tell you things? Are you going to, just ask them whatever questions you have. What does suicide feel like? What should I look for? Like, they're just there to help chat with you. So if you've never called, give them a call. The only thing I want to say in addition to that is if you call, it's happened a few times, if you call and someone's just really short and they're not having a good day, just say, thanks so much, and hang up. And you can call back. We all have bad days. Yeah. And every once in a while, you'll just get someone that's like, maybe not the most helpful. They honestly may have just had a really rough call and they're not ready for another one. So we're all human.
Yeah.
Yeah, like
Great advice.
I
Yeah.
can't imagine doing it all day long. So like if you
Oh,
get
man.
someone, it's okay. Just say thanks, appreciate it. I think we're good. Do whatever you need to do, and just call right back. You'll never get the same person. And then hopefully the next person is a little bit more grounded. Like
Yeah.
probably all of us have experienced,
Yeah.
working with students.
Yeah.
Yeah.
So getting that text from a student or having to call 988, those are down the line, hopefully. Are there early warning signs that we as leaders can keep our eyes open for so that hopefully we can identify, okay, this kid is going through something and we can get ahead of it before we actually get that text months
Yeah.
down the road or something?
Yeah. Yeah. It's a great question. Some pretty common warning signs are, like low mood, withdrawing from activities they used to enjoy, maybe no longer enjoying certain activities, not being their typical bubbly self. And again, that's like some ongoing kind of long-term stuff. But and when I was in high school, like I certainly really, I was thinking about it all the time. My ideation was like very present 24/7. And so
Wow.
I really appreciated when leaders were like, hey, like, you doing okay? Like you seem like a little more down. And having someone come and ask me was always helpful. If you have never, talked to someone about suicide, you can't give someone the idea of suicide. So just bringing it up is not going to convince them to then be like, yeah, now that you mentioned it, I don't want to be here anymore, right?
Yeah.
Like similar to cancer, like you're not going to bring up cancer and then be like, oh, now that you'd asked me if I have it, I do, right? Like we can't catch it like,
Yeah.
Yeah.
like something. And so, if kids are feeling really down, likely if they're thinking about suicide, they already have thought about it without like long before you're maybe even gonna catch on. And so I would say just always ask. Like it's way better to ask than not to ask. And I've had some really awkward conversations. We just kind of laugh about it later and I'm like, all right, cool. Like, and I will blame it on myself too of like, look, I've been there and I just always wish people would ask me. Um, and and so you can just simply ask them like, hey, you've seemed to be doing like not so hot, or you've expressed that life has been really hard.
Yeah.
Have you felt suicidal, or is this just like some low weeks? And they'll probably tell you. But also be prepared that if you're going to enter into that conversation, you just also showed them that you are a safe person to talk to about that. So we do need to have some sort of like system as well in place so that you have some additional support, and you then know kind of follow-up steps. But I would say typically lower mood. We talk a lot. We have a depression like workbook that has a lot of tools you can work through. We can maybe link some of those later or have them. They're on our website. But we spent a long time just being like, how do we create a depression workbook for someone that doesn't want to do anything? And so the first half really is just like check-ins, like, hey, how can we just care for ourselves in the day in and day out? What does that look like? It talks about hygiene, it talks about nutrition, it talks about like even some gratitude practices. It even talks about some like lamenting and spiritual formation practices. Like, where does Jesus meet us in this depression? Because he certainly has sat with, people over the history of the world to like, he understands it. He gets it. He is aware of like what it feels like to lose a friend and to have the weight of the world on his shoulders, right? And so how do we enter into spaces like that? So there's some resources that kind of simplify it, but if depression is left unchecked, it is more than likely that it will lead towards worsening depression. It's just not gonna go anywhere unless we're actually working on getting it better. It's insidious. It's like going down a really like low incline freeway and you don't realize you're at the bottom of this massive hill until you're at the bottom of it, right? Like it's not going to just all of a sudden be better. It's a all encompassing chemical imbalance and yeah. So if we're seeing kids withdraw, if we're seeing kids over time like really struggling, then it's always good to ask. And as I say that, there's also kids that are really, really good at hiding it.
That's what I was gonna ask. It's common also for kids to not show signs, but also have the ideation. And then with that, are there good, just general questions that we should often be asking any kid to, to start those conversations?
Yeah. Yes. And we also can't force anyone to tell us.
Sure.
One of our board members lost her son to suicide, and they talked about mental health all the time with him, right? And sometimes we just don't, we're just not going to catch it. So yeah, with that, like the more we talk about it, the less stigmatized it is. We use a number system often with young people. And so like 1, and you have to define the numbers too. So like 1 is I'm really low. And what does really low mean to you? So for me, 1 is like, I probably should go to the emergency room, or we like all hands are on deck, which means 3 or 4 is like, I'm really pulling some people in. We're tightening up on some things. We're making sure that I'm like able to rest and sleep and do all those things. 10 is whatever I want to define it as. It's not Disneyland, but it might be like camping in the woods with my husband and our dogs. And it's a good day. Like I feel happy. I'm stoked on life. Right. And so using a number system gives kids an opportunity to share their experience and what they're holding without then having to unpack all of it. And so I used to lead a small group, and we would go around before we even did our small group questions. And I'd be like, hey, I want to hear what number you're at. And, I would make up one other question, and we just start with that. So we just normalized like, and if you're a 1, 2, or a 3, I'm just going to have a follow-up question. We're not going to spend the whole small group deep diving into your really awful day. But I do want to just make sure that I have some time and awareness so that I can come chat with you. And I've had kids that are like the life of the party come up to me after, check in as like an 8 or a 9, and then be like, hey, I'm not okay. Like, okay. And it's just giving them an opportunity to say like, hey, I need some help, or I don't know what to do here. But yeah, I think normalizing it, I also think just like the more adults we have sharing that we also struggle with mental health, that it's not just a teen thing, that we're willing to sit in it with them. And I'm not trying to fix them. I'm not trying to like tell them what to do. It's not my job to fix your situation. But what I do want to do is like sit with you in it so that you at least feel less alone and figure out maybe some next steps that you might be able to take.
Yeah, no, it's good. I think, and I think even thinking about being a part of youth groups and different things, like it just reminds me in leading in some of those spaces, we don't have to have an answer for it all. We don't have to Jesus juke them and be like, well, God's got it. You're good. I mean, we can talk about God's goodness and make space to have those conversations too simultaneously, and don't, and obviously, they'll learn that piece of it, or learn that God loves them even in that, which is good. But no, that's really, really, really helpful. Just thinking about how do we asking ourselves those questions of how can we make room? How can we incorporate some of these things? What would you say? Are there any things that you would say for sure that we should not do? Like, are there any like this, like if you're going to not do these couple of things, these are those things?
Yes. Yeah. One, we never want to minimize someone's experience. So we never want to argue them on it. We never want to not take it seriously. We're not, going to tell them like, it's not that bad. We're just going to always take what they're saying at face value, and become curious in that. Like, so we're not going to argue it, but we're going to become curious in asking better questions. What's that like for you? How does life change when you experience that? Can I help you in a certain way? If you don't know what that looks like, can we explore some options together? We also never want to keep suicide a secret. So I've heard students be like, hey, I want to tell you something, but like, you really can't tell anyone. I called my best friend and said goodbye to her in high school when I was like, please don't tell anyone. And she went and talked to her dad like immediately, who then called my dad. So within 3 minutes, like I had someone in my bedroom. And so suicide's never a secret. And I honestly don't know what would have happened if she hadn't gone and talked to her dad. Definitely a scary thing, but I always say, like, I would rather have someone be really mad at you for a couple weeks than to not have them be here anymore. And I hope as adults we can handle some kid being mad at us for a couple of weeks.
For in ministry, we can handle it, I think.
Knowing that, like,
we'll be just fine.
And like, your life is way too important for me to keep this a secret. And it's not something to be ashamed of. I know a lot of people that struggle with suicide off and on. I know a lot of adults that have attempted, and I know a lot of people that have died to suicide. And so the more we can normalize it, the better. I would also say, if someone's sharing with you about their experience with suicide, we really want to make sure that we're watching our face. We don't want to be shocked. We don't want to be surprised. And if anything, we want to be like, oh, like, thank you for trusting me enough to tell me that. That is probably the greatest honor, to sit with someone in like some of their worst, scariest, darkest thoughts. So we don't want to minimize it. We don't want to keep it a secret. And if someone tells you that they're struggling, we don't want to have that be the last conversation. If they're opening up to you, it can't stop there. You have to then have some ongoing follow-up conversations. Now, if you don't have capacity and you genuinely are like, man, I can't believe this kid opened up, I have my own stuff going on, because that's what happens sometimes. It's then a responsibility to like collaborate with that student on who kind of that safety team is. I've had people open up to me about some things, and before anything, again, will be like, wow, thank you for telling me. Like, man, I really am so honored, and I love you, and I'm here for you. I'm going to be really honest. I would rather disappoint you in this moment and tell you, like, I don't have a whole lot of capacity right now, than long-term disappoint you by not showing up. And so I don't know if I can be someone that's like a weekly check-in for you, but what I can say yes to right now is helping you to figure out who those people are. And so for the next week, let's make sure that, like, I want to make sure you have a team. And I also know it probably took a lot out of you to share that with me. And so can I go sit with you as we share this with a few other people? Because I don't want you to feel like you're doing that alone again. But I would love to invite some other people into this, because what I don't want is for you to do this alone. And I also know, like, I don't know if I'm going to be able to show up to the best of my ability, and I want to show up well for you. But that's just my capacity right now.
A lot of times we work with, young people who don't know Jesus. They aren't following Jesus. They don't go to churches. How do we integrate faith into conversations about mental health?
Yeah, it's a great question. I think we go at it at kind of two different ways. So the church can go at it at a totally different way. There's some things that maybe play into some mental health, of like the enemy convincing us of lies, of things like that. And I also think that, like, Jesus is like one of the most real things in helping to sit with us in those spaces. But our bodies also are made up of parts, right? Like, we are physical beings. We have a brain that's like thinking and can get sick, and we also have souls, but then we're also relational beings, right? And so With students, when it comes to mental health, I think it's really important to also remind them, both in the church and not in the church, that like mental health is a real, like physiological experience that we have. It affects every area of our life. And I think I wish a lot more people just started with the like physical symptoms, the relational symptoms when it came to mental health. I think if we're thinking about even like needs that kids have, if they're riddled with anxiety and depression, they're not thinking about like a long-term thing that we're committing our life to that's gonna
Yeah.
improve, our like
Yeah.
long-term eternal life, right? Like what they're actually thinking about is like, how do I get through today? Not looking like a fool, not, stuttering, like
Yeah.
getting through my test. Like how do I just show up in the relationships that mean the most to me? And so um I think it really starts with like just the relational aspect of like,
Okay.
hey, I know, and I know you guys know that like Jesus wants to meet them, and is going to do that in his timing in, the most perfect way. And that he's not far from them in the midst of their anxiety and their depression. But I also think that it's our role to be the hands and feet of Jesus to these students before they meet who he is, right? And so to be that like steady, peaceful presence, to be someone that's not shying away and also is not constantly just bringing everything back to Jesus, right? Of like,
Yeah.
oh, hey, like
Just
I
pray
actually,
more.
yeah, yeah. It's like, no, actually, I care about your experience. I care that your anxiety is like crippling you. And rather than being like, come to club, it's really loud and we're going to play some cool games and you're going to probably have even more anxiety. I'm just going to like sit with you at lunch and be like, oh, how'd that test go? I know you were really anxious about it, right? It's the like ongoing long-term relationship that I think really helps with anxiety and depression. We also have we have a 10-week course on anxiety and depression. We ran it with students for a couple of years, and we actually realized that what kids need right now are adults that just show up and are willing to sit with them in that conversation. And so we actually took out all of the formation pieces out of it. And we're like, we want to just give churches an opportunity to like just have a 10-week anxiety and depression cohort. It's like formed exactly like Alpha. You watch a video, you sit around a table, you just ask conversations or have conversations, ask questions, share experiences. It's very clear in what it is and what it isn't. It's not therapy. We have a crew out in Boise, Idaho right now doing it. And like, it's been a game changer for these kids to all of a sudden like realize, oh, these leaders for like Youth for Christ or Young Life or whatever church it might be, like genuinely just care about me.
Yeah.
And for 10 weeks, we're just going to talk about the thing that I want to talk about, which is like, I can't get through school without a panic attack. We have a couple of options for churches if they want to run that. And again, it's all video form. And so you literally like hit play and it's just really basic psychoeducation. But I'm glad you asked that, Ryan, because I feel like what kids want right now is adults that are willing to sit with them in those conversations and not have the answers, not fix them. Be willing to say like, I don't know, but let's figure it out. And I think that leads to then being able to share Jesus, share, that piece.
And that really aligns. I mean, number one, our often our motto, I remember even 20 years ago doing ministry and we talked about meeting kids where they were, like going to campuses, going to sports. So this is just like a deeper layer of that same thing, but also in conversations with Brad Griffin, with Fuller Youth and Josh Packard, looking at Gen Z and Gen Alpha in general. I mean, you're talking about specifically mental health, but even in general, that seems to be the biggest thing is we want adults who will listen to us and be in there with us. So I think, what you're saying, that's just a great practice as a whole, including, sitting down even more in that, which is great to see it in these different layers, I think.
Yeah.
As we wrap up, a couple things. I would love, you shared about that resource, and I was looking on your website and seeing, I saw there was a 4-week course as well. Could you share a little bit about what are some of the different resources that you guys offer, and then maybe just other resources out there that you would say are really great that we should point people to as they're getting started in this?
Yeah. Yes. Great question. So we have those like anxiety and depression courses. Those are available on our website. The top right, it says courses, and it takes you to our course page. We do have a parent course as well. And so if you have parents that are like, I don't know what to do, that's a great place to point them to. And then Cory, you just mentioned our 4-week free mental health series. So this is meant for youth groups, or like a, Youth for Christ style. I know Young Life has like campaigners. I don't know if you guys have like more of a discipleship track.
We have a lot of different, lot of different
a lot of different
small
things.
groups. Yeah.
Yeah. So for that, though, we definitely dive into like, what does the Bible say about anxiety and depression? And then we spend a whole week on like unpacking Judas's suicide. And so even just talk about like suicide in the Bible of like, I share more of my story. Tyler Hands is our board member that talks a lot about our, spiritual formation and how do we incorporate Jesus into our walk with mental health. And then we also just talk about like, who are you as a student? Are you a supporter? Are you a struggler? Or are you that silent struggler that we mentioned earlier? The one that's like, trying to get into Harvard, or your parents have really high standards for you, or you just don't talk about it at home and there's not a place for you to talk about it. It's again, similar like video content. Leaders have a leader's guide, discussion questions. And it's just meant to be like, we realize youth pastors or youth leaders don't have time or the know-how to have a conversation around mental health. And so we would love to be honored to come in and have you guys play that video. And then we also have a thing we just came out with. It's called our Course Pass. So if you're like, hey, I actually want like monthly resources from you guys, we have live Q&Rs, we have Zoom calls, community calls, where we just pop on and we say like, what questions do you have about mental health? How do you incorporate this into your youth ministry? And then with that, you also get resources for the individual. So you get like 4 weeks of that anxiety and depression course that you could walk with students through, but you also then get resources for supporters. So our youth leaders have resources that you get for a couple months. Our parents have resources. And then our team also wrote like spiritual formation practices. So I know this podcast is like first a follower.
Yeah.
How do you, right, like as a leader, care for yourself through this? We just wrote trauma-informed spiritual formation practices. So if we're talking and you're like, man, guys, this is me, not my students. Like, I'm really struggling. We just wrote a whole couple of practices on Sabbath and silence and solitude and lamenting through the lens of like mental illness. So you struggle, but like, how do we practically meet with Jesus in those spaces? That feels maybe a little bit more attainable or feels like a little slower pace than maybe some of the other practices that are out there. And then the last thing is we do have a couple of workbooks. I mentioned our depression one. I actually have our toolkit right here. But this guy right here, if you have a student that is struggling with suicide, this goes through like all of the crisis intervention steps. So this is something that like there's things to fill out here, but there's also the crisis hotlines in here. There's like low, medium, and high level interventions in there for you. So it really is trying to simplify like, okay, someone told you they're really struggling. How do we now actually take that moment on in discipling young people or our friends or ourselves in like building out that safety team. Who are their mental health professionals, but then also who are the friends? Who's a safety team that you're going to call, but then who's the like distraction teams is what we call it. So who are the friends that like you're not going to talk about any of this, but you're going to come up for air and you're going to go on a walk and they always make you laugh, or you play basketball with them, or we need those people too, right? And so this book just helps to like get it all out. It was written from kind of my own safety team and process of like, what do my people actually need to know? They need to know my warning signs, but they also need to know how I'm behaving when I am doing really well versus when I'm not doing well and I'm trying to hide it, right? There's clear behavioral changes in that. And it's helpful to have it on paper. So it's kind of written from my own team, but then our vice president works at Kaiser in their adult inpatient facility. And it's also kind of some of their resources when it comes to like things that he's walked people through, things that are really important to have on paper as like you're going back out into your daily life. So that's a really great one. It's small. It's by far our most clinical one. I mentioned our depression workbook, and then we also have an anxiety workbook. All of those are age ambiguous. We've had parents walk like 10-year-olds through those with them. But they all are founded in like psychoeducation and spiritual formation. So it really is an intersection of like not just mental health, but how do we include Jesus in this conversation, because he definitely is at the center of it. But I think we sometimes just don't know how to talk about, inviting him into those really rough spots without being like, just pray about it.
Yeah. That was great resources.
But like, what does that look like? Yeah.
And that's all on wearespeakout.com, right?
Yep. Wearespeakout.com.
Yeah, and we'll have all this stuff in our show notes as well if people want to do that. And then 988 is the suicide hotline. Yeah, and that is super great. Well, as we in wrapping up, we always take a little time at the end of our episodes to just slow down, pause, take a moment, take a breath. Yeah. Would you be willing to maybe lead us in a practice that might be centering or help us slow down?
Yeah. Yeah. If you feel comfortable and you're listening and you're not driving per se, would you close your eyes? If you are driving, please keep those open. But why don't you just go ahead and get comfortable where you're at? If you're standing and moving around, I just would invite you to sit down somewhere. Just feel the weight of your chair holding you up, your feet flat on the floor. Maybe your jaw has been clenched, or you feel a little bit of anxiety in your chest. Just notice that. You don't need to do anything about it quite yet, but just simply notice and observe any tension that you might be holding. And then let's go ahead and just take 2 deep breaths together. In for 4. We're going to hold for a few seconds, and then just breathe out for 4. Just do one more. Breathe in for 4. Just hold for 4. And then just breathe out for 4. And then just in this space. Mindfulness can be really hard for some of us because our brains are just swimming with things. But just in this space, I want you to just imagine a place that you feel really calm. Maybe it could be a place you feel safe. Maybe it's even where you're sitting right now. But just imagine what it looks like, what the scenery is, maybe what it sounds like. For me, it's the beach. So maybe you hear some waves crashing. And again, I just want you to bring to mind all that you can about that safe place. And then in that place, it's helpful when we carry a lot in our bodies to just have a moment to just settle, to slow down, to not be on our phone, to just listen to our bodies for a minute. Maybe there's tension that you're carrying in that place. Maybe there's actually a big weight or a stressor that you brought with you that you were unaware of. So just right now, I just want you to imagine picking that up for a minute and then finding a nice safe place to just leave that. It could be dropping it off a cliff. It could be kicking it. It could just be setting it next to you. What does it feel like to just set it down for just a second? Maybe you don't feel anything different. That's okay. And I just want you to think of maybe one thing that you wish someone would tell you right now. Maybe it's I'm proud of you. Maybe it's I love you. Maybe it's like you can ask for help. You don't have to do it on your own. Whatever it might be. What's that just one thing that you need to hear right now? And then I just want you to put your hand on your chest. And we're just going to say that thing over ourselves in our brain. Just remind us that we actually can come into attunement with Jesus, with the Holy Spirit, and be kind of that safe person. So what does it feel like to just speak that over yourself? You don't have to do it out loud. You can. Yeah. And then when you're ready, feel free to open your eyes and notice something new around the room. It's helpful to just look around, familiarize yourself with where you're at. Yeah. I think a lot of like inner healing work happens when we're able to be the adult that we need in those really stressful spaces. So it's helpful to have a moment to just set some stuff down. Like as youth leaders, you carry a lot. So I'd just encourage you in spaces like find a practice to like set it down. And remind yourself it can be a truth in scripture, or it can just be something you wish you needed to hear.
Yeah, that's good.
Is that a daily thing, a weekly thing?
Yeah.
How often should we be doing that?
Yeah, it's a great question. So we rise to the lowest level of training. We never rise to the highest. And what I mean by that is like the more we do something like a daily rhythm, and it doesn't have to be that long, but a daily rhythm is going to be a lot easier to reach for in moments of stress when we really need it. So there's weeks that I'll just sit on the couch. And I'll take a few deep breaths before I drink my coffee. I'll notice my body. There's other times that I'm like, man, I have not done that in so long and my body like really needs it. And so I'll do like more of a longer weekly thing. I think some people will get like really nervous about mindfulness because they're like, my brain's just spiraling. There's no right or wrong way to do it. And I think the easier, it gets easier the more we do it. The more familiar we become to it. It's helpful too to like actually put your hand on your chest and feel something up against you. It's our way of kind of attuning ourselves. My therapist will often have me be like, okay, so if you are feeling your childlike self in whatever that is, the stress that you're feeling triggered from something, your hand gets to be that adult self that you need to feel right now, or the other person's presence. What does it feel like? And if you can kind of switch back and forth too of like, what does young me need? And then switch to adult you. Like it's hard work, but man, it's worth it when we're able to like, okay, we don't need to fix it. Mindfulness is just bringing us back to the present moment. It is not fixing all of the problems that we have, but it's slowing us down enough to then figure out like, what's my next step? What do I need to do now? Could I actually just leave that weight there for a while? And I know where it's at. I can come back and I can visit it. I can pick it up when I need to. But yeah, having some kind of like mind map where you can just leave stuff is helpful.
Yeah. Well, and I think until we slow down, we forget how much noise there is and how busy we are.
Yeah.
I actually did with our youth group at our church just a couple weeks ago. I was doing a message, but before I did, I just did basically just the breathing piece, and we did like 7 breaths in and out, real slow, and we were thinking about breathing in God's presence, breathing out the anxiety, and just and my daughter is a high schooler, and afterwards I was like, how was tonight? And she's like, I really liked that. Was really nice to just slow down and breathe and be quiet, and so we just are moving and we forget. So it's so good.
Yeah. And even like when we're by ourselves, we have our freaking phone on us all the time. Like it's not quiet, right? Like there's still noise. And so, or we're listening to something on our AirPods, or so we can take just an intentional moment to like breathe and slow down. Our bodies are trying to tell us what we need. Sometimes we just got to listen to them.
Yeah. That's so good. Well, awesome. Well, thank you so much, Lauren, for being on. And I know that there's a lot. Hopefully people will go to wearespeakout.com and check out some resources, because I know there's a lot of things we weren't able to get into. We just really scratched the surface. But thanks for coming and sharing that and just getting us started. And thanks, Ryan, for being on as well. Really appreciate the conversation. So good.
Yeah. Thanks.
First to Follower is a podcast from Youth for Christ USA. The views and opinions shared by hosts or guests are their own and don't necessarily reflect the official positions of YFC or any partnering ministry. This podcast is for encouragement and general information only, and it isn't meant to provide legal, medical, mental health, or theological advice. If you enjoyed the content, please like and subscribe. And if you would like to learn more about how to get connected with Youth for Christ in your area, visit yfc.net.